Hello, I'm Dr. Sarah Martinez, and for over 25 years I've dedicated my career to geriatric medicine, specifically caring for patients over 60. In my decades of practice, I've seen countless seniors dismiss critical warning signs as simply part of getting older. But here's the truth that could save your life. Your body doesn't lie, and certain symptoms after 60 are never normal, no matter what anyone tells you. Have you ever felt something unusual in your body and wondered, should I be worried about this? The reality is that after 60, your body becomes more vulnerable, and what might seem like a minor issue could actually be your body's desperate cry for help. These aren't just aches and pains, they're emergency signals that demand immediate attention. Today I'm going to share with you 6 deadly symptoms that doctors see in the emergency room every single day. These are the warning signs that, when ignored, can lead to tragedy within hours or days. But here's the good news. Knowing these symptoms and acting quickly can be the difference between life and death. By the end of this video, you'll have the knowledge that could literally save your life or the life of someone you love. So let's dive straight into these life-saving warning signs, starting with number 1. And trust me, this first one is more common than you think. Number 1. Sudden, explosive headache. Unlike any you've experienced, imagine this. You're going about your normal day when suddenly, out of nowhere, you're hit with the most intense headache of your life. It feels like someone struck you with a hammer, and within seconds the pain becomes unbearable. This isn't your typical tension headache or even a migraine. This is something completely different. Doctors call this a thunderclap headache, and it's one of the most dangerous symptoms you can experience after 60. Why? Because it often signals a brain aneurysm that's either leaking or has already ruptured. A brain aneurysm is like a balloon on a blood vessel in your brain, and when it bursts you have minutes, not hours, to get help. Here's what makes this so terrifying. Many people experience this explosive headache and think, I'll just lie down, and it will pass. But lying down could be the last thing you ever do. When an aneurysm ruptures, blood floods into your brain, causing massive pressure and potential brain damage within minutes. The headache often comes with other warning signs: sudden nausea, vomiting, sensitivity to light, and sometimes a stiff neck. You might feel confused or even lose consciousness briefly. Some people describe it as the worst headache of my life, and that's exactly how you should treat it. Another deadly cause of sudden severe headaches in seniors is a stroke. While most people think strokes cause weakness or slurred speech, sometimes the only symptom is an excruciating headache that comes out of nowhere. This happens when a blood vessel in your brain either bursts or becomes completely blocked. So what should you do? If you ever experience a sudden, severe headache that's completely different from any headache you've had before, don't wait. Call 911 immediately. Don't drive yourself to the hospital, don't wait to see if it gets better, and don't take a pain reliever hoping it will help. Time is brain tissue and every minute matters. Number 2. Persistent chest discomfort that comes and goes. Now let's talk about something that kills more seniors than almost anything else, but often goes unrecognized because it doesn't look like what you see in the movies. I'm talking about heart attacks, specifically the kind that don't cause crushing chest pain. After 60, especially if you're a woman, heart attacks often present very differently. Instead of that dramatic clutching your chest moment, you might feel a persistent discomfort in your chest that comes and goes over hours or even days. It might feel like pressure, fullness, or a squeezing sensation that's hard to describe. Here's the scary part. Many seniors dismiss this as indigestion, acid reflux, or just stress. They take an antacid, sit down for a while, and when the discomfort eases slightly, they convince themselves it was nothing serious. But your heart muscle is literally dying while you're deciding whether it's bad enough to seek help. This type of heart attack, called a silent or mild heart attack, is incredibly common in people over 60. Your heart is crying out for help, but the signals are subtle. The discomfort might spread to your arms, neck, jaw, or upper back. You might feel unusually fatigued, short of breath, or nauseous. Some people even experience what feels like heartburn that won't go away. Women are especially at risk because their heart attack symptoms are often completely different from men's. You might feel an overwhelming sense of fatigue, like you've just run a marathon when all you did was walk to the mailbox. You might have back pain, jaw pain, or feel like you're coming down with the flu. The danger is that damage to your heart muscle is happening whether you feel severe pain or not. The longer you wait, the more heart muscle dies, and the worse your chances of survival become. Even if the discomfort comes and goes, even if it's not severe, even if you're not sure, these symptoms in anyone over 60 should never be ignored. What should you do? If you experience any persistent chest discomfort, pressure, or pain that lasts more than a few minutes, especially if it's accompanied by shortness of breath, nausea, or unusual fatigue, call 911 immediately. Don't drive yourself. Don't wait until morning. And don't worry about being embarrassed if it turns out to be nothing. It's better to be wrong about a heart attack than to be right and do nothing about it. If you're finding this information valuable and it could help save a life, please hit that subscribe button and turn on notifications so you never miss, potentially, life-saving content like this. Your support helps us reach more people who need this critical information. Number 3, new or worsening shortness of breath picture. You're sitting in your favorite chair, reading or watching television, and suddenly you feel like you can't catch your breath. You haven't been exercising, you haven't been active, but it feels like the air has become too thin to breathe properly. This is a medical emergency waiting to happen. Shortness of breath that comes on suddenly or gets progressively worse is never normal, no matter your age. After 60, this symptom is particularly dangerous because it can signal several life-threatening conditions that require immediate treatment. One of the most deadly causes is a pulmonary embolism, a blood clot that travels to your lungs. This can happen to anyone, but seniors are at higher risk, especially if you've been sitting for long periods, recently had surgery, or have been less mobile than usual. The clot blocks blood flow in your lungs, making it impossible to get enough oxygen. Without immediate treatment, this can be fatal within hours. The terrifying thing about pulmonary embolism is that it often starts subtly. You might first notice you're slightly more winded than usual when climbing stairs. Then maybe you feel short of breath when doing simple tasks around the house. Eventually, you're gasping for air while doing nothing at all. By the time you're struggling to breathe at rest, you're in immediate danger. Another common cause of sudden shortness of breath in seniors is congestive heart failure. This happens when your heart becomes too weak to pump blood effectively, causing fluid to back up into your lungs. Many people wake up in the middle of the night gasping for air, or they find they need to sleep propped up on multiple pillows just to breathe comfortably. Heart failure doesn't mean your heart has stopped. It means it's not working efficiently. But left untreated, it can quickly become life-threatening. The fluid in your lungs makes it harder and harder to get oxygen, and your body starts shutting down non-essential functions to conserve energy for vital organs. There's also the possibility of a silent heart attack, where the primary symptom isn't chest pain, but severe shortness of breath. This is especially common in diabetics and women over 60. Your heart muscle is being damaged, but instead of pain, you experience overwhelming breathlessness, often accompanied by extreme fatigue and nausea. Here's what you need to know. If you experience new shortness of breath, especially if it comes on suddenly or gets worse over time, don't wait to see if it improves. Don't assume it's just because you're getting older or out of shape. Sit down, stay calm, and call for emergency help immediately. Number 4, severe abdominal pain that won't go away. Let's talk about something that many seniors ignore until it's too late. Severe, persistent abdominal pain. You might think a stomachache isn't serious, but after 60, certain types of abdominal pain can signal medical emergencies that require immediate surgery to save your life. The most dangerous is a ruptured abdominal aortic aneurysm. Your aorta is the largest blood vessel in your body, running from your heart down through your abdomen. Sometimes a section of this vital artery weakens and balloons out like a bubble on a tire. When that bubble bursts, you can bleed to death internally within minutes. The pain from a ruptured aortic aneurysm is unlike anything you've ever experienced. It's a deep, tearing sensation in your abdomen, lower back or side that often pulses with your heartbeat. Some people describe it as feeling like something is ripping apart inside them. If this happens, you have minutes to get to an operating room, not ours to decide whether it's serious enough to worry about. But here's the scary part. Abdominal aortic aneurysms often don't cause any symptoms until they rupture. That's why they're called silent killers. However, sometimes you might feel a deep aching pain in your abdomen or back that comes and goes. This could be the aneurysm expanding and putting pressure on surrounding tissues, a warning sign that rupture could happen at any moment. Another life-threatening cause of severe abdominal pain is intestinal ischemia, where blood flow to your intestines is suddenly cut off. This can happen due to a blood clot, a twisted bowel, or severe narrowing of the arteries that supply your digestive system. Without blood flow, your intestinal tissue begins to die, leading to gangrene and potentially fatal infection. The pain from intestinal ischemia is often described as cramping or aching that becomes progressively worse. Your abdomen might feel distended or tender to touch, and you might not have had a normal bowel movement in days. Some people experience nausea, vomiting, or fever along with the pain. Gallbladder attacks are another serious concern for seniors. While younger people might experience gallbladder problems as isolated episodes, in seniors, these attacks can quickly lead to dangerous complications like infection or rupture. The pain is typically sharp and stabbing, located under your right ribs, and often gets worse after eating fatty foods. Here's what many people don't realize. Severe abdominal pain in seniors can also be a symptom of a heart attack. This is especially true for women and diabetics. Instead of chest pain, you might experience intense upper abdominal pain, nausea, and vomiting. Your body is in crisis, but the signals are confusing. So what should you do? If you experience severe, persistent abdominal pain that doesn't improve with rest, or gets progressively worse, don't wait. If the pain is accompanied by fever, vomiting, or inability to have a bowel movement, it's even more urgent. Call 911 immediately. Many of these conditions require emergency surgery, and delaying treatment can be fatal. Number 5. Sudden confusion or mental changes. Now let's discuss something that's often dismissed as just getting older, but can actually signal a life-threatening emergency: sudden confusion, disorientation, or dramatic changes in mental functioning. When your brain isn't working properly, it's never just about age. Something serious is happening that requires immediate attention. One of the most critical causes of sudden confusion in seniors is a stroke. While many people think strokes always cause obvious symptoms like paralysis or slurred speech, sometimes the only sign is acute confusion or disorientation. You might suddenly not recognize where you are, be unable to follow simple conversations, or feel like your thoughts are moving through thick fog. This type of stroke often affects areas of the brain responsible for cognition and awareness rather than movement or speech. The person might seem alert and able to move normally, but they can't think clearly, remember recent events, or make sense of what's happening around them. Family members often notice that something is off, but can't pinpoint exactly what's wrong. Another dangerous cause of sudden mental changes is a brain infection, such as meningitis or encephalitis. These infections can develop rapidly, especially in seniors whose immune systems may not be as strong. What starts as mild confusion can quickly progress to delirium, seizures, and even coma if not treated immediately. Severe dehydration is another culprit that's often overlooked. As we age, our sense of thirst diminishes, and it's easy to become dangerously dehydrated without realizing it. When your brain doesn't get enough fluids and electrolytes, confusion and disorientation can set in rapidly. This is especially dangerous during hot weather, or when you're sick and not eating or drinking normally. Medication interactions or toxicity can also cause sudden mental changes in seniors. If you take multiple medications, and most seniors do, there's always a risk of dangerous interactions or buildup of medications in your system. What seems like sudden dementia could actually be medication poisoning that requires immediate medical intervention. Blood sugar emergencies, both high and low, can cause severe confusion in seniors, especially those with diabetes. When blood sugar drops too low, your brain literally doesn't have enough fuel to function properly. When it's too high, toxic substances build up that can affect mental functioning. Both situations can be life-threatening if not corrected quickly. Urinary tract infections in seniors can also cause dramatic mental changes. While younger people typically experience obvious symptoms like burning or frequency, seniors with UTIs often present with confusion, agitation, or behavioral changes as their primary symptoms. The infection can quickly spread to the bloodstream, causing sepsis, a potentially fatal condition. Here's what you need to understand. Sudden changes in mental functioning are never normal, regardless of age. If you or someone you know experiences rapid onset of confusion, disorientation, or dramatic personality changes, seek emergency medical care immediately. Don't assume it's just part of aging or something that will resolve on its own. Number 6, uncontrollable bleeding or bruising. Our final deadly symptom is one that many seniors notice, but often dismiss as a normal part of aging: excessive bleeding or bruising that seems to happen for no reason. But after 60, when your blood doesn't clot properly or you bruise from the slightest touch, it could signal a medical emergency that requires immediate attention. One of the most dangerous causes is a severe drop in platelet count, called thrombocytopenia. Platelets are the tiny blood cells that help your blood clot when you're injured. When you don't have enough platelets, even a minor bump can cause massive bruising, and any cut can lead to dangerous bleeding that won't stop. This can happen suddenly due to medication side effects, autoimmune disorders, or blood cancers like leukemia. You might notice that you bruise easily from activities that never caused bruising before, or that small cuts take much longer to stop bleeding than they used to. Some people develop tiny red spots on their skin, called petechiae, which are actually tiny hemorrhages under the skin. Another serious concern is internal bleeding that you can't see. This might show up as unexplained bruising, especially large bruises that appear without any memory of injury. Internal bleeding can occur in your digestive tract, brain, or other organs, and the only external sign might be unusual bruising patterns on your skin. Certain medications commonly prescribed to seniors can cause dangerous bleeding problems. Blood thinners like warfarin or newer medications like rivaroxaban are designed to prevent clots, but they can sometimes work too well, leading to life-threatening bleeding episodes. Even common medications like aspirin or ibuprofen can increase bleeding risk, especially if you take them regularly. Liver disease is another serious cause of bleeding problems in seniors. Your liver produces many of the proteins necessary for proper blood clotting. When your liver isn't functioning properly, your blood loses its ability to clot effectively, leading to easy bruising and prolonged bleeding from minor injuries. Here's what makes this particularly dangerous. By the time you notice external signs of bleeding problems, you might already be experiencing internal bleeding that could be life-threatening. Bleeding in your brain, stomach, or other vital organs can happen with little warning and can be fatal within hours. So what should you watch for? If you notice that you're bruising much more easily than usual, if small cuts won't stop bleeding after applying pressure for several minutes, or if you develop large bruises without remembering any injury, seek medical attention immediately. Don't wait to see if it gets better, and don't assume it's just because your skin is getting thinner with age. Final thoughts. Your life is in your hands. If you've stayed with me through all 6 of these deadly warning signs, you now have knowledge that could save your life or the life of someone you love. These aren't just symptoms to be aware of. They're emergency signals that demand immediate action. The biggest mistake seniors make is dismissing serious symptoms as just part of getting older. But here's the truth. While aging does bring changes to your body, sudden severe symptoms are never normal at any age. Your body is incredibly wise and will always warn you when something is seriously wrong. The key is listening to those warnings and acting on them quickly. Remember, time is often the most critical factor in medical emergencies. The difference between life and death can literally be measured in minutes or hours, not days or weeks. When you experience any of these symptoms, don't wait to see if they get better. Don't try to tough it out, and don't worry about bothering anyone or feeling embarrassed. I want to hear from you in the comments below. Have you or someone you know ever experienced any of these warning signs? What did you do about it? Your experience could help others recognize these symptoms before it's too late. Please share this video with your friends and family members, especially those over 60. This information could save a life. And spreading awareness is one of the most powerful things we can do to protect the people we care about. If you found this video helpful, please subscribe to our channel and hit the notification bell so you never miss potentially life-saving health information. Your support helps us continue creating content that could make the difference between life and death for seniors everywhere. Thank you for watching, and remember, when it comes to your health after 60, it's always better to be cautious and seek help than to wait and regret it later. Stay safe, stay informed, and we'll see you in the next video.